Hi, my name is Catherine Go. I'm an assistant professor of vascular surgery at Charleston Area Medical Center in Charleston, West Virginia. So patients with peripheral arterial disease with and without diabetes are at high risk of coronary events such as heart attack and limb events such as amputation. I think this research offers new treatment that could change best medical therapy to prevent these adverse outcomes in our fragile peripheral arterial patients. We use the TriNetX database, which is a consolidated network of over 100 healthcare organizations' electronic medical records, and we included patients with moderate peripheral arterial disease, and that's defined by an ankle brachial index of 0.4 to 0.9. We were able to identify 55,000 patients that were started on a GLP-1 receptor agonist, and we compared them to another 55,000 patients that were propensity matched, but were not started on a GLP-1 receptor agonist, and we followed them for 1 year and looked at their cardiovascular outcomes. So GLP-1 receptor agonist treatment was associated with fewer cardiac events, fewer limb events, lower mortality, and fewer hospital admissions. Even though the treatment group started out with a higher A1C, a heavier baseline weight, and higher cholesterol, the treatment group also experienced fewer adverse cardiac events. So I think that may imply that the glucagon-like peptide 1 receptor agonist acts not just by glycemic control, but throughout their multiple effects of protective benefits. And something surprising that we found was patients, even without diabetes, benefited from treatment with GLP-1. GLP-1 receptor agonists provide a global cardiovascular benefit for both patients with diabetes and without diabetes with moderate peripheral arterial disease. And I believe that vascular surgeons should keep a line of communication open with their patients' other healthcare providers to ensure that they're getting the best medical therapy treatment possible. I believe this retrospective study provides strong evidence to justify a randomized control trial, which could change best medical therapy in patients with peripheral arterial disease. Additionally, we would have to expand our research population to include patients with severe peripheral arterial disease, because currently our data is limited to the patients with moderate peripheral arterial disease. So patients with wounds and patients with ischemic rest pain were not included in this study.